we are going to talk about the obstetric thromboprophylaxis risk assessment and management. That is the Appendix 1 of the RCOG Green Top Guideline number 37A. Now this appendix is extremely important but at times a little difficult to remember. So today we will go and try out a mnemonic to remember the risk factors. Now this appendix is mostly divided into two sections, that is the antenatal assessment and the postnatal assessment. So the antenatal assessment is for the times when the patient comes for booking or whenever she is admitted. So that is the time when she is pregnant and she has to be assessed for risk factors that may need prophylaxis, thromboprophylaxis. So first we will talk about the antenatal risk factors. Now when we're talking about the antenatal assessment, mostly when the patient comes for booking or when she is admitted, the antenatal assessment, the high risk or the red zone is a patient who has a history of thromboembolism. So this is very easy to remember. Any previous history of venous thromboembolism. Now there's only one exception in this scenario, and that is if she had undergone a major surgery and related to that she had a single event of VTE. That single one event is excluded. Apart from that one event, almost all the cases of patients with previous venous thromboembolism will be categorized in the high risk category. Now this one exception that we are talking about, it falls into the intermediate category. That is, if there was only one VTE following a major surgery, then that is single episode which was very much provoked, so that can be given a little bit of benefit and that falls into the intermediate category. Otherwise, all previous histories of VTE will fall into the high risk category. Now, in which category, how much to give, that we'll talk later. Now we'll only categorize and remember what falls under which category. Okay. Now to remember the intermediate category, there is a very beautiful mnemonic that we have here. Okay. Now this is a hospital. Okay. This is the name of the hospital is a VTE hospital. So as you can see, this lady has entered the hospital. So hospital admission during pregnancy is again, once you are into this hospital, it is a intermediate risk factor. Okay. Now into the hospital, as you can see, this lady is undergoing a surgery. So during pregnancy, any surgery, any surgical procedure, like for example an appendicectomy, again that is an intermediate risk factor. So once in the hospital, first risk factor. Now on the surgery room, in the operation theatre, another risk factor. Okay. Now we will talk about this lady. She looks fit and fine. Okay. So she is a symptomatic. But what is she doing? She is walking on a rope which is so high up, it can be seen from the window. So she's definitely doing some high risk stuff. So she symbolizes high risk thrombophilia in patients who are asymptomatic. Okay, asymptomatic. She looks fine, so she's asymptomatic, high risk thrombophilia. This is what this high risk lady is symbolizing. Okay. Now next is a very interesting factor. This man. Okay. This man is here to tell the doctor, because he looks a little worried, because he remembers that previously she had a surgery where she had a single episode of VTE. So now she's inside the theatre, so he wants to tell the doctor that in the last surgery She had a VTE. Okay. So this man is telling us about another risk factor, that a single event of venous thromboembolism following a major surgery. Okay. Now this man is extremely important. So we have to observe him very closely. He looks very inflamed. See, look at his eyebrows. He's so inflamed. Why does he look so inflamed? You can see his joints are also swollen. There's so much of inflammation, which signifies that he has inflammatory bowel disease and inflammatory polyarthropathy. See, poly, 1, 2. Here also, everywhere there is swelling. So, inflammatory polyarthropathy, inflammatory bowel disease is what is making this man very inflammatory. Okay. Now, this man, he is a very active man. Okay. And his name is Lee. Okay. Of course, he has to be given a name. He is an active leader. His name is Lee and he is very active. Okay. Now what you can see, he's looking at this girl. Okay. Now she's very pretty, but she is sick. She is sick. Okay. So she is symbolizing sickle cell disease. Okay. She looks sick. The sickle cell disease. Now the moment this man looks at her, now he is totally melted. She's so sweet that he gets diabetes. And he's young, so type 1 diabetes. But there is a nephew over here, you know. He is observing everything. So this nephew is very important because he is adding nephropathy to the diabetes that he has acquired because he looked at this sweet woman and now he has diabetes. And this nephew is also symbolizing nephrotic syndrome. Okay, so this nephew, you can see he is looking at a cancer. Okay, he's looking at a cancer and he's saying, oh my gosh. So this gosh is nothing. See, there is a cancer in the surgery room. Oh my god, gosh. This gosh is ovarian hyperstimulation syndrome, which will require thromboprophylaxis only in the first trimester. Okay, this is something we have to remember. Ovarian hyperstimulation syndrome is a transient factor, so it will be scored in a way that we have to give thromboprophylaxis for the first trimester only. So this man, this active Lee man, he is a druggist. He is an intravenous drug user. You can see, okay. So with so much of he's active and he's inflamed and he's the druggist of the movie. But the moment he looks at the sick, beautiful girl, he also gets a heartbreak. There is heart failure, and he gets diabetes. And this nephew is there, so nephropathy in the diabetes and the nephrotic syndrome, and the nephew happens to notice a cancer in the surgery room and he's saying, oh my gosh, he's so scared. So this in a nutshell is all about the intermediate risk factors for antenatal thromboprophylaxis with mostly low molecular weight